The mint fines, the simple part is that the thread, which is a 2/0 15 centimeter thread, is already in the cannula. The difficult part is if you pull back before you reach there, the thread comes out. You got to make sure you reach the mark in the perfect plane the first time. You don't get a second chance. We're going to do 4 mint fines on each side. These are the drawings, and we're going to put 1 packet of 4 mint fines each side. I like to use 8 threads on the marionettes to increase the duration, hopefully around 6 months. You want to put the entrances behind the sideburns and behind the angle of the jaw. Then you inject 25 cc's of 0.5% lidocaine with epinephrine. You can do this with a spinal needle if you want to avoid that second needle stick on the face that you see here. You numb all the tracks subcutaneously, then prep the skin with Hemiclens. You make 2 1.5 millimeter punches per side. And when you pass these fines, you're going into the deep subcutaneous space. You have to go along the lines, and you can't pull back on the cannula even for a millimeter, or the needle will come off prematurely and get all curled up in the face. You tie 3 knots on each side. You cut the excess threads on the knot. You don't put them too tight. It tends to accord the skin, as you saw there. You pull the skin up to bury the knots. You repeat this on the other side, staying deep subcu so that the threads are not easily felt later. These threads do lift the skin well, and then you wash off these marks with peroxide, and then you're seeing her 1 day later. Minor bruise on the left could have been avoided had a spinal needle been used for the numbing. With the mint minis, the threads are heavier with bigger barbs, and the cannula is separate from it. Here you're seeing the cannula with the blunt passer in it, and you're passing it in deep, going to the mark, staying deep, putting the barbed thread, the barbed end in first, and then pulling out the cannula while you're holding onto the thread at the end. You then push up on the soft tissue, up onto the barbs, and then you tie them to further secure them, even though they are bidirectional. The extra security is actually important. I do like to do them behind the hairline because it holds them better, because you have more barbs to hold by keeping the more of the thread in place. You always want to pass deep in the cheek area, a little more superficial when you're over the parotid, but always deep enough that you don't see the dimpling from these threads. Always pushing up the soft tissue on them, and then tying them, and then cutting them on the knot. And here you're seeing 1 day after versus a month afterwards. Now with the Mint 43s, the setup has a temporal needle. This is the Mint 43, which has the strongest and longest lasting lift. The more threads, the more you can pull, and the younger you can make the person look without dimpling, and the longer it's going to last. I already gave her 50 cc's of 0.5% lidocaine with epinephrine, so I'm prepping and draping her, but I always give a little more local to the entrances and exits, because you're going to actually be poking through with a sharp needle through there. This is how you're fixing these Mint 43s to the temporal fascia. You catch it very easy. Don't go deep. It bleeds really easy there. You go superficial when you're over the bone, but then you go deep as soon as you're in the cheek. You don't go as deep over the parotid is all, but when you're into the cheek, you can go quite deep. It should be painless. There shouldn't be any force. You're just going in the deeper, fatty layer. And when you get to the very top one, you want to cross it, so go from the middle hole to the top exit by the eye, because you don't want the thread to come too close to the eye. Pull the hairs out that tend to get in there. You pull on all these threads. You palm the soft tissue up. You cut the threads as short as you can cut them. Do the same thing on the other side with the 3 1.5 millimeter punches. You're passing the threads through. You're starting superficial over the bone at the zygoma, but then you go deep when you're past it. You always want to pinch and pull the skin up. It helps you go deep. You're staying superficial to the muscles, though it should be painless, and it should pass very easily. Over the parotid, you'll notice you can't go as deep because you'll be touching the parotid, and you want to stay on top of the parotid fascia. You push the cheeks over the threads, you cut the thread short, and then you just pop off the dimples, not all the threads. And the next day, sometimes I put a little filler in. The morning after, you're seeing her before I release the dimples, then I actually release them. It's probably the best time to do it because there was too much numbing to do at the same time. And here you're seeing her after the filler. She looks quite a bit better. 1 day after, looks much younger. The face is going to feel a little tight for 2 weeks, and it actually hurts a bit that night. The other days it just feels tight. I give them Celebrex for discomfort. And here you're seeing that the very next day it is an instant facelift. Those little marks are pretty much gone after a week. Here you're seeing her 2 weeks after. So this is another mint lift with the Mint 43. The difference is there's only 6 threads, which means it's probably not going to last as long. I never like to do less than 6 threads. And they're also going to have the Mint Easies for the brows. I always like to braid the hair. This hair seems to get caught on the barbs of the threads, and it just pulls all the hairs into the face and brows. I'm marking 6 exit sites there on each side fairly evenly, and 2 of them for each side of the brow. prepping and draping the area, giving plenty of local, especially to the entrance and exits and all along the tracks, using some 0.5% light. Again, with epinephrine, you can come from above and below with a 25 gauge 1.5" long needle. Make sure the entire area is numb though. Same thing on the brows, and you use 30 gauge needles to the entrance and exit sites. You prep the face, drape it. You can even use a little Tegaderm to hold the hair down here if you like. You're putting the temporal passer in. You're putting in 3 threads all at once. That's what can fit basically into 2 holes. I like to cross this first one so it's not too close to the eye. So basically I'm using the bottom hole coming out the top exit. And you first goes with the blunt passer in, then you pull back on the blunt passer just in 1/2 inch. You let the sharp passer go through, and then you're threading the Mint 43 threads through, pulling the cannula out from below. And so you'll basically see what looks like 6 threads. It's actually 3 U-shaped threads that are hooked onto the temporal fascia. You grab these threads, you pull on them, and you push the skin up, and then you cut these threads as short as you can so you don't see them later when you're smiling. Doing the same thing on the other side. Once again, the top one we're crossing just so that the thread doesn't show up too much at the corner of the eye. I like to go actually just past my mark so I don't tattoo the skin. The palm is going to once again though lift the facial skin up as high as I can get it, and then you're pressing it with scissors to cut them. On the brow lift, I like to actually go about 1 inch behind the hairline. I go through 1.5 millimeter punches up there, pull it up quite a bit, and then do the same thing on the other side. You're basically coming out just about 1 centimeter short of the each ends of the brows underneath the brows. Pull them up, cut them short, and then just release the dimples. I always like to clean the skin with peroxide afterwards, and then put some gentamicin cream on the holes and release any obvious dimples while they're still here. And in this case, platysmal bands are being treated with some Botox. This is immediately after the procedure. Usually have them come back in a day.
The day after the procedure, you see the white swelling from the numbing is gone, and you see the benefits of it, which is the minimal bruising of her face, and you do see the benefits of the threads. There's an immediate lift.
The Mint Easies are simpler to use because the threads, which are heavy, are already connected to a needle, but since it's a sharp technique, I only like to use it in the brows and the neck where you're not going very deep. So in the neck, first I add tumescent anesthesia, and the same thing in the brow to prevent pain and bruising because it is sharp the whole time. And then I do make 2 1.5 millimeter incisions in the center of the neck. I go straight in so you don't catch the dermis. Then you come out on each side, behind and below the earlobe. You pull the threads taut, but not too much, just a little dimpling on the ends that you're going to release. And you cut the threads short and you release the obvious dimples. And on the brows, I always like to give a little more local to the exits and entrances. And I like to stay pretty far behind the hairline, maybe 1 inch, 1.5 inches behind the hairline. It helps with the lift. And you go straight across, once again, those 1.5 millimeter holes. You're coming out below the brow, about 1 centimeter from the ends of the brow. And you're cutting them short after you pull the brows up and then release any obvious dimples. The lift is subtle. It lasts about 5 months on the brow.